Question number 1. Which of the following is a common side effect of ACE inhibitors? The right answer is option B, hyperkalemia. Question number 2. Which of the following is a beta blocker used to treat hypertension? The right answer is option B, metoprolol. Question number 3. Which class of drugs is used to lower blood cholesterol levels? The right answer is option B, statins. Question number 4. Which medication is used to treat type 2 diabetes by increasing insulin sensitivity? The right answer is option B, metformin. Question number 5. Which drug is anticoagulant used to prevent thromboembolic disorders? The right answer is option A, heparin. Question number 6. Which of the following is an example of a macrolide antibiotic? The right answer is option B, azithromycin. Question number 7. Which medication is commonly used to treat acute asthma attacks? The right answer is option A, albuterol. Question number 8. Which of the following is the first line treatment for hypertension? The right answer is option B, diuretics. Question number 9. Which of the following drugs is used to reverse opioid overdose? The right answer is option A, naloxone. Question number 10. Which of the following is a side effect of long-term corticosteroid therapy? The right answer is option B, osteoporosis. Question number 11. Which drug class is used to treat fungal infections? The right answer is option B, antifungals. Question number 12. Which of the following is used to treat hyperthyroidism? The right answer is option D, both B and C. Question number 13. Which medication is used to treat peptic ulcers by inhibiting gastric acid secretion? The right answer is option A, ranitidine. Question number 14. Which of the following drugs is a calcium channel blocker? The right answer is option D, both A and C. Question number 15. Which of the following medications is used for the treatment of Parkinson's disease? The right answer is option A, levodopa. Question number 16. Which of the following medications can be used to treat anaphylaxis? The right answer is option A, epinephrine. Question number 17. Which medication is a first-line treatment for generalized anxiety disorder? The right answer is option A, buspirone. Question number 18. Which of the following is a commonly prescribed drug for the management of epilepsy? The right answer is option A, phenytoin. Question number 19. Which of the following drugs is an anticoagulant that works by inhibiting vitamin K? The right answer is option A, warfarin. Question number 20. Which of the following is a selective serotonin reuptake inhibitor? The right answer is option A, fluoxetine. Question number 21. Which medication is used to manage heart failure by inhibiting the angiotensin converting enzyme? The right answer is option A, lisinopril. Question number 22. Which of the following is a side effect of the use of NSAIDs? The right answer is option C, gastric ulcers. Question number 23. Which of the following drugs is used to treat bacterial infections caused by the gram-positive bacteria? The right answer is option A, vancomycin. Question number 24. Which medication is a commonly prescribed diuretic for heart failure patients? The right answer is option D, furosemide. Question number 25. Which of the following is an anti-diabetic drug that works by stimulating insulin release? The right answer is option A, glymephoride. Question number 26. Which drug class is used to treat fungal infections like athlete's foot and ringworm? The right answer is option B, antifungals. Question number 27. Which of the following medications is used for the treatment of gout? The right answer is option A, allopurinol. Question number 28. Which medication is used as a long-term treatment for asthma in chronic obstructive pulmonary disease? The right answer is option B, Monte Leucost. Question number 29. Which of the following is an antiemetic used to treat nausea and vomiting? The right answer is option A, ondansetron. Question number 30. Which of the following drugs is used as a first-line treatment for tuberculosis? The right answer is option D, all of the above.